our monthly series with the Aging Life Care Association. And there's actually no better way to kick this off than to have a conversation with the president of the board of directors, Steve Bartlam. And Steve is the newly appointed president. And so love to welcome him to the stage and get to know Steve a little bit better, but more importantly, especially for anybody who's listening to this that's not familiar with aging life care managers, is understanding what this important profession is about and how we can access their services. So, Steve, first off, welcome and really delighted to have you here today.
Steve, thank you so much. What an honor and what a treat to be able to talk about something that's so close to my heart.
I love it. Now, I'm really curious about your personal story, but before we dive into that, give the folks a broad overview of what this profession, aging life care managers, is and how it helps folks.
Okay, what I would say is aging life care professionals are primarily comprised of social workers, nurses, allied professionals, people who have some experience as well as perhaps a degree, a professional who's been involved in aging or work with dependent adults. And the focus of what they do, it really boils down to three things. So aging life care professionals really start off with understanding. That's really about assessing, really trying to get a good picture. And what are they assessing? It's really around four different things. It's about understanding what people want, what's important to them. It's understanding what they need, sort of the physical needs, the emotional needs, the spiritual needs, the whole range of what people might need. The third piece has to do with risk factors, like what puts people at risk. It could be social isolation, it could be fall risk, it could be nutrition risk, it could be not managing medications or substance misuse or abuse or things like that. And then the last piece is really understanding people's strengths. So when we can do that well, understanding what they want, what they need, the risk factors, and their strengths, it's then with that information putting together a plan, sort of figuring out a roadmap of how do we address the needs, the problems, the issues, the strength, all those kinds of things, putting together a plan in place, figuring out what will family do, what will the older client do, what will we as professionals do, who are we going to tap into, is it a move to a facility, is it a staying at home, and figuring out what resources are needed. And then the last piece is really just monitoring. Once we get the things in place, we then can keep an eye on the situation to ensure that things run smoothly.
I
So
love it.
that, in a nutshell, sort of what care
Yeah.
managers do.
No, I love it. And we're gonna jump back to that. I had a bunch of questions that popped into my head when you were talking about that, but let's get to know you a little bit better. And we were chatting briefly before we got on, and I was congratulating you on being the president of the board of directors, and he's like, "Well, this is a role that I actually had 20 years ago." So you've
Yeah.
been in this profession quite some time.
Yep. So I started off my career back in 1985. So it's like 40 years now. I was in graduate school at UC Berkeley on the West Coast, where I'm living right now. And after that, I went to work for a nonprofit, Jewish Family Service. And I worked there for about 5 years. And after that, I started my own private practice. Did that for 10 years. And what I was doing was consulting families and really helping people through the maze and figuring out what they might need. After that, I was approached by a venture capital company. And so we created a national model based on care management at the core. And during that time, I became the president of the Aging Life Care Association, which was called the National Association of Professional Geriatric Care Managers.
Yeah.
You can see why we shortened it. And then I did that for about 20 years. And then the nonprofit organization tapped me on the shoulder and said, would you help us create this viable model of care management and home care, integrating the two in a way that whatever profits are generated in our nonprofit organization, it can go towards serving the neediest of the needy. So I've seen it like on lots of different, from a small practice to a large national practice to nonprofit setting. And it's been a wild and woolly ride, but a fabulous one all along.
Yeah, I mean, I haven't been in this profession as long as you have, but I've been in it long enough to see one uh what I feel is a wonderful change. And that was when I started in this, and probably for the first 10 or 15 years, explaining to people what geriatric care managers were. And that's
Right.
what we called this profession back then. And now, more often than not, I go to a barbecue or a non-aging social gathering, and I hear people talking about the care management firms that they've hired. Like it's and everybody knows what they're talking about. We still have a long way to go, but the awareness of your profession amongst the public, it's exciting. I never would have imagined that it would be to the
It's
level
sort
that
of
it's.
like that hockey stick where we're about to see really it
Yeah,
take off, of really going up. And it's all about awareness. It's really helping the public understand what we do and as well as attract members. And that's sort of what our passion is at the association.
yeah. Well, I'm going to share my screen. I want to share the Aging Life Care website real quick because I
Perfect.
want to also make people realize how how easy it is to locate an aging life care manager in your region, no matter where you are. If you go to aginglifecare.org, which I'm dropping into chat, you can find a wealth of resources. But the really easy to navigate the aging life care, the orange button, and y'all have a great search tool. You can do the advanced search or what have you. But in essence, I think you can just, and it's always scary when I do something like this, but if you basically just
But
I'm just
if
gonna
you put 90210, like people are familiar with the Beverly
I've
Hills.
seen that TV show
Yeah, exactly. Right.
90210. Uh that's Beverly Hills, folks. It's You see, it'll bring up your a variety of care managers, and I highly recommend, if you're a consumer and you haven't done so, contact a few of them. Most of the care managers that we have on here have a free initial 30-minute consultation, and you can kind of get a feeling on, is this a good match?
It's all about the gestalt. It's about, do you feel comfortable with this person? Do you feel confident that they're going to be able to solve my problem?
Yeah.
And so, yeah, exactly. So it's always good to have a couple of conversations so you can have that peace of mind that you're working with the right individual.
Yeah. Now, when you were going through the four principles of the or four elements of care management, when I asked you about the definition, one of the things popped into my head is something that you said. A lot of times, families are the ones that call aging life care managers. And actually, a lot of times, I recommend to families you need to call a care manager because the adult children are they're concerned about mom, but they're not in agreement on, one wants this, the other wants this, and the other wants that. It's like, call a care manager. And I'm often reminding them that just because you call the care manager and just because you pay the bill doesn't mean that you're the client. Can you share a little bit of the insight on how you all work? I mean, because I think this is was eye-opening to me the first time that I heard.
Yeah, no, that's a really good concept. And I think it underscores one of the things that's really important from the association's perspective. We have spent years and years and years of developing standards of practices, as well as code of ethics, and really wanting to sort of set the standard for the profession. And so one of the issues that you raise has to do with confidentiality. So when we engage with a client, we want our clients to be able, that's generally the older adult in need, to be able to share information, be open with us so that we truly understand the situation so we can gather the right resources and ultimately make a difference, sort of, turn the dial for that person, for the family. Families will come back to us and say, so tell us exactly what happened. And what we normally do is when we're working with the older adult, we ask them, would it be okay if we share the information that we've gathered with certain family members, the ones who've engaged with us? 85, 90% of the time, that's fine. And if the older adult gives us that permission, it's great. It's very, it's the highest ethics. But if that older adult says, I'd prefer you not share this information, we're really clear with the families, even if they're the ones paying for services, that we're ever so clear that that information needs to be held in confidence, and we will do our best to do right by the family, but we need to protect that information. Again, it's really about really high standards and acting in the highest ethical manner that we can. And that's what the association has worked, over the last number of years to really continue to refine it, think about it, because we want to protect our clients and protect families as well.
No, I love it. Now, here you are, your second term, albeit 20 years apart as the
Yes.
president of the board of directors. Tell us a little bit about what the future vision of the association, which directs this profession.
So I'm a firm believer in investing in people. In my own practice, it's all about raising people up and making them the best that they can be. Because when we do that well, instead of our mission being about the end user and the older client, our mission is about how do we take better care of our employees and how do we develop them and how do we make them into better professionals. In the same way, our association is all about raising up our profession and the professionals that are involved, all of our members. And we do that with our standards, with our ethics, with conferences, with webinars, with education, with written materials to really focus on raising the profession up. And we truly believe that if we stick with our values, with our core values, and we're consistent in our behaviors that are tied to those values, then we create a culture. And that culture is one that is so attractive to professionals who want to be part of an organization that's really about delivering really good quality service with integrity. And that's what our association is about this year. It's really focusing about raising up our professional members to engage, because we know when we do that well, we're going to attract more members, have a louder voice, and really do some fantastic work out there.
And I'll tell you, I mean, that's so important because every every organization, business, trade association that touches the lives of older adults, we are we've got this demographic shift that requires just to make this profession attractive so that we can care for all these people that we are
And you can look at the color of my hair that I have been around the block quite a bit, a lot of times. And so we're really challenged, as you said, Steve. How do we attract that next generation of professionals? And they are out there.
oh yeah.
They, and they're not also, we are clever and we're open to not just doing things the way that we've always done things. We realize that we need to embrace innovation, we need to embrace technology, we need to embrace different ways to do what we do. And also, it's not just social workers and nurses that make great aging life care professionals. We have in our mix, in our folds, occupational therapists, physical therapists, physicians, attorneys. We have administrators of communities, of assisted living, of skilled nursing facilities. We have people of different backgrounds who have great experience, and we really want to keep our arms open.
All right. And Beverly, you're taking the words right out of my mouth. Okay, so we set the table. We know what aging life care is. We know what the association is. And Beverly says, exactly what does this agency do? Give us some examples and talk about cost for services. And so let's dive in. And I know,
Sure.
Steve, you're with a specific
Right.
Steve, as the president, he runs a shop,
Yeah.
but globally, we're talking broadly from
Oh,
California to the profession of aging life care.
it's a great question. There is so many different specific things that a care manager can do that it's hard in a way to give you a really good sense, but I'll give you a couple of examples. People will call us most often, probably 80-90% of the time, we get calls from the adult children. And the adult children are saying, I don't know what to do. Something has happened. We got a new diagnosis. My mother just broke her hip. My father isn't able to take care of my mother. My mother just passed away, and my father is left alone. And all of a sudden, we're drawn into, as family members, of what do we do? How do we best respond to the needs? So, a care manager can be involved in a really short term way of just assessing the situation and giving the family some ideas of saying, you know what, this is what we're seeing right now. These are the needs, these are the issues, these are the strength, all those things. Here's a roadmap, and here are some resources, specific local resources that could positively impact the life of that older adult. It might have to do with bringing joy to that person's life. It might be about social engagement. It might be about activities to get that person engaged. It might be a referral to a neurologist or to a cardiologist or to a good geriatrician, a doctor specializing in geriatric medicine, to help shed some light on things, what might be needed. So it could be just very encapsulated from a one-time meeting and a list of resources to families who are living out of town and who are concerned about a parent who might have just gotten a new diagnosis of cancer. So a care manager could physically be the one who goes to the medical appointments, takes notes during the appointments, ensures the right follow through, and communicates that with involved family that the client has allowed us to share that information with. So it's a whole range, or it could be finding a community in assisted living or something like that. So there's a big range of things that care
Well,
managers can do.
yeah, and I've got a few threads that have that we talked about on some of these roundtables that I'd like to bring up to you. But
Yeah.
one thing in particular to kind of tack on to Beverly's question that I found where families are exceptionally grateful for aging life care managers is helping somebody who's aging in place. Okay, like
Yes, 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 yes.
because when you make the decision to make a move to XYZ community or what have you, there you have a variety of resources that are there, and an aging life care manager can still help there.
Right.
But I think what families don't realize is how much coordination may take place if someone is aging in place with with healthcare changes, what have you. And having an aging life care manager that can help you coordinate, get, modifying the home so it's more accessible and safe, bringing in outside help, then just managing the household chores and things of that nature. Um, uh, I've often found people just raving about having it, they sort of compare it to having like a quarterback that is
I'll
if
give you a great example. As you know, we have experienced sort of horrendous event with the wildfires in Los Angeles. That's
oh,
where
and you are in
yeah,
You're
I'm
in Los
in
Angeles.
Los Angeles
Okay.
proper. And so we had a number of clients who needed to be evacuated and they didn't have any local family who was able to help, and they were aging in place. And so, as the care manager who is involved, my teams were involved in finding hotels, finding assisted livings, finding short term alternative living arrangements for folks, maintaining really good communication because the kind of information that people get from the news across the country is a little bit different than somebody who's right there seeing what's happening and communicating. And just providing the peace of mind that there was somebody local who could take care of the details. I was on the phone with hotels, like just trying to find rooms for my clients who were in need, who were being evacuated with little notice, and we were successful. So it's really about having somebody on the street, so to speak, who could be your local eyes and ears and hands to help manage the
Yeah.
details.
Yeah, and so many times we hear from folks, we're thrown into this role and we have no knowledge of it. We're learning as we go. And the cool thing is that having an aging life care manager, you've got this knowledgeable person that's also not necessary that's advocating for the best thing for the older adult, not necessarily the tied into the family history and all that type of stuff. Let's see. Okay. And Erica says, yes, I'm in Los Angeles and can use this resource because I'm excited to network with this group of professionals. So happy to have found you. Okay. So sorry, great, Erica. We're happy to have you too. And the fact that you're an LA native, just like Steve.
Unbelievable. Yeah.
Okay, so here's one of the interesting things, and I kind of feel like this is a very positive trend. Um, in general, throughout my career, aging life care managers are oftentimes called in crisis situations where you get that call, mom fell, she's in the hospital, they're saying that she needs to go somewhere, I need help making this decision.
Right.
I call an aging life care manager. But as I had mentioned earlier, this trend of solo aging, and when I say trend, I guess this term and this community that's developing around the topic of solo aging,
Yeah.
folks that identify themselves as solo agers are now eager to make a connection with an aging life care manager and kind of have a relationship there so that in the future, if they need it,
We
they've got somebody. Are you
we
seeing this in your practice?
we are seeing more and more of it, and there are two different kinds of variations on the theme that we're seeing more of. Number one, the solo agers, in terms of wanting to make sure their wishes are known, that in the event something happens to them, that somebody can pick up the pieces quickly and respond and not wait to the crisis. Then we also have another that's alike that might have family, but they're out of town, and they don't want family swooping in with the best intentions, second guessing what they would have wanted. And so it's all about creating contingency planning, of or contingency plan. And care managers are great for getting that stuff down. We do a lot of work with husbands and wives where there might be one of the members who might be impaired, maybe with a dementia or something affecting their cognition. And the well spouse says, I want to get this down in writing because if something happens to me, I don't want somebody coming in and, again, with really good intent, making bad decisions, things that I would not want to see for my spouse. So it's really putting down and writing simple things like my spouse likes to get up at 10 in the morning. He likes to, be in his pajamas till noon, and that's okay. Please don't change that. He likes to get his hair cut at Joe's barber, downtown. And it's getting those little details that if you don't know, if something happens to the well spouse, life is traumatic enough for that poor person needing the care for things to completely go topsy-turvy. So we try to just capture some basic information, and it's similar, sort of a variation on the theme with solo agers as well. Like just getting that stuff down of having a partner.
I love it. All right, we got some questions coming in here. Let's see. Beverly is asking, can you talk about how do you pay for a aging life care manager and
Yeah.
give us some range of costs?
Yeah. And so what I'll tell you is what I know from across the country. It's generally an hourly rate. So you get what you're paying for. Uh, and it's generally broken down by parts of an hour. Some people charge by quarter hour, some people charge by tenths of an hour. And generally, the rates are anywhere from $50 an hour to $250 an hour. It really depends on the community. So New York City will be very different than Little Rock, Arkansas. Uh, it's just what the market will bear in that community, and that's sort of the going rate. So by going to the association website, which you pulled up before, the aginglifecare.org, and click on Find a Care Manager, you can just have a quick conversation with a couple of people, and you'll find within a community there won't be such a wide range. But there is a wide range throughout the country based on the community.
Metropolitan versus
A
rural.
rural, a
But
small
yeah.
rural community, exactly.
And then I'm based in the DC area, and we've got some nonprofits and I believe a government agency that has aging life care management
And
program.
so some programs are on a sliding scale through nonprofits, and a lot of area agencies on aging, the AAAs as they call it, have provided funds throughout most communities across the country to provide some level of public case management, which is similar to the aging life care model of assessment, care planning, and monitoring. But oftentimes the public agencies have long waiting lists, and they don't have the flexibility that a private company can provide as many hours that you might want. A private company will give you as much time as you want or need, whereas a public agency might have to met out what they can provide because they have limited funding.
Okay. Um, Here's a good question. Is this association similar to a place for mom? Because I find that you're much more robust.
Okay.
Erica, I'm glad you threw that question out. I'm
That's
curious.
a great question. So, we're talking about individual aging life care manager practices across the country, and they're very different than a place for mom. A place for mom primarily focuses on alternative living arrangements. That was how they initially got set up, and they are paid by the facility that they refer to. So they don't charge clients any money, but they also don't necessarily have the professional background, nor are they able to do the robust kinds of services, as you pointed out, of dealing with medical issues. We have many care managers who are RNs or nurse practitioners who can really get into the very complex, challenging situations and make such a huge difference in a client's life, right? Of getting the right care in place and avoiding costly mistakes of, engaging with the wrong sorts. And so a place for mom has its place on the continuum of aging services, but I would say it's a much more limited service, primarily focusing on different living arrangements and having an aging life care professional who is paid by the family versus the facility avoids any kind of conflict of interest and allows for greater choices, generally speaking, but there's a cost for it. So it's a trade-off.
Yeah, and the aging life care manager, I heard somebody answer a similar question. The aging life care manager, you're paying them and they're working for you.
Right,
um, an organization like a place for mom, that's the communities that are providing them with referral fees, that's who's
right.
paying them, that's their ultimately their customer.
Right.
um,
So it's different. I'm not in any way bad mouthing them because there is a place along the continuum, but it's a very different
yeah.
service on what an aging life care professional can provide.
Yeah, no, but Erica, thanks for that question because it is something that does oftentimes come up. Like I had mentioned, when you have the cocktail party and people are talking about their care managers, and then it's like, oh, I called a place for mom, and then the discussion ensues, you know.
Right.
So,
Exactly. Exactly.
okay, let's see. Okay. Now, let's see. How do you managed care agencies charge for services? Is there a difference between the charges for short-term services and an ongoing need for care? Alice, um, yeah, I guess, like as Steve said, most are hourly rates, I guess.
Right. So I want to be really clear because it gets a little bit mixed up between caregiving services, having a caregiver come into the home and provide care. That's a very different, that's an hourly rate, and you can get that short term, you can get that long term. And then there's care management, which is really the professional consulting with the client, with the family, and being able to assess the needs, put together the plan, monitor, get things, implement services that are needed on behalf of our clients. And that's the aging life care professionals' focus is more the latter.
Got it.
And our
Um,
association, just to let you know. So we've been talking a lot about the individual practices that people
Mhm.
have. And so the association that I'm president of is really made up of all these practitioners across the country. And they're really focused on the association supporting them to provide education, training, again, to make sure that people are delivering this high level of service. They're vetted to become a member of the association. We have different levels of membership depending on whether you're certified or not. And so it's really an organization that's all about protecting consumers from all those people out there who are saying, I can help you with an elder care issue. You want to make sure that you have somebody who has experience and who's been vetted.
Okay, let's see. Carolyn asks, typically Medicare and other health insurance won't cover the cost of these services. Is that correct? But what about long-term health
Care
insurance?
insurance. Real, oh boy, sophisticated caller or participant on this. I'll tell you, you're absolutely right that Medicare today isn't reimbursing for traditional aging life care professionals, geriatric care management, but that's changing. There are some new programs out there that Medicare is starting to pay for. And so they're putting their toe in the water, so to speak. There's a program called the GUIDE program, GUIDE, and it's really about dementia care for family caregivers. And they realize the government, and I don't know how long that will be in place, given our current environment,
Yeah,
but
I'm a
we're
little
not
scared
getting into
about that one
politics,
myself.
right? There's some changes going on, as we all are aware. But Medicare had committed to looking at paying for some level of care or case management. And so that's an exciting trend. Long-term care insurance, the kind of insurance that traditionally would have paid for a skilled nursing facility and most recently is now paying for home care and now paying for daycare programs, uh, is now starting to pay for some care management. So I have to tell you, it is evolving, and this is an exciting time. Is it there? Not all long-term care insurances do pay, but it's important to check with the policy, uh, the people who have put out the policies.
Okay, so question about living trusts or trusts or uh is that something that Erica was
Aging
asking?
life care that we get involved with. We are not, I mean, for the most part, we have a few members who are attorneys, I have to tell you, but we do not practice law, but boy, do we know what to look out for. So, yes, when there are issues pertaining to estate planning and trusts and wills and powers of attorney and durable powers of attorney and all the different advanced directives that are out there, aging life care professionals know what to look for. So we can answer some basic questions, but we generally guide folks to the right level of professions. So care managers generally know the best elder law attorneys, estate planning attorneys, specialists in medical fields, neurologists, cardiologists, geriatricians, and the like, to be able to refer to. So yes, we can help in terms of identify this is an issue that needs to be addressed, but we won't necessarily be the ones addressing it ourselves because we know our own scope of practice and we want to use and help families, get to the right people.
Okay, great. Now, let's see. Question on levels of membership. So does the association provide certifications and how would you become certified and is there a cost to do that?
Okay. There are a number of different certifications for care managers out there, from just having the right insurance and having a business license. You can get some level of certification, but does that really differentiate yourself from anybody else? Not really. The association, uh, there is our association actually endorses three different uh, certifications through the Nursing Association, through the social work. NASW has a certification, and there's one that is for community-based
Is
uh,
this
care managers, which
is
is
this like
NATM.
I pulled up
Exactly.
okay, so I pulled up this page here. Uh,
Thank you. So the National Academy of Certified Care Managers, uh, also NASW, and the Commission for Case Managers, which is, yes, more of a nursing like, not through the Nursing Association, but through CCMC. That's accurate.
okay, cool. I'll drop that into chat for everybody. Um,
And there's
okay,
various costs associated with getting certified.
okay. Great. Okay, let's see. Okay. Ali Sultani, who is with an organization called Handy Pro, and they do universal design and remodeling services. He had a
Love it.
question. How can we have an educational event planned for the organization? And this is probably a good time to bring up that there's the National Association, but then there's smaller chapters that and there's conferences and meetings and things like that.
So I would say if you're involved with a national association or a group, even if it's a local group, it would be great to reach out to Julie Wagner at the Aging Life Care Association, who is our executive director. And she will be able to figure out how to field that, right? Be able to get it to the right person within our association, to be able to figure out, are there ways to collaborate? Because one of our core values is collaboration. And it's so critical for us to do our work well, is we need to play well in the sandbox with others. I would very much be interested in finding out more about that organization, and would highly recommend having that person please reach out to Julie at our association.
I love it. All right, Alice is on the call and she says, what if a person needs help on and off, but is fine on her own for the rest of the time? And she says, I live happily on my own. But actually, Alice, I think you're tailor-made for an aging life care manager.
Right,
What?
there generally isn't any minimum. So I've had many clients, Alice, where I might have been involved at the very beginning, doing an assessment, meeting with the person, pulling together some initial resources that they needed at that time. And then they call me as needed. So I might not hear from that person for a year, 6 months, 2 years, but inevitably, when the need arises, they know who to call. And I just ask them, please try not to wait until the crisis. Because can I be helpful during a crisis? Absolutely. But can I be even more helpful to you? And it will be less costly if I could get involved just a little bit ahead of a crisis, because then you'll have more choices and more options.
Yeah, oh, that's great. Beverly asks, does the association make recommendations for income tax individuals to do their taxes? This is that time of year when we're starting to get bombarded with the fact we're going to have to do our taxes pretty soon. Uh, Out of curiosity, like, how does that work?
I've had, generally I recommend to people to speak to their friends, to really find out who are their friends using, who, have done right by them, because it's such a trust industry, right?
Mhm.
Uh, and have we made recommendations to bookkeepers and accountants? Absolutely. Uh, and we will do so. Generally, I'll only do it if I know the people that I'm referring to. I'm not just going to look online and get a list of people and say, good
Yeah.
luck. And if I don't, I'll be honest with people and say, I'm so sorry. I don't have good resources at this time. Uh, I just want to be part of the solution, not the problem.
Yeah, yeah. But no matter who you end up choosing, if you've got an aging life care manager in your corner, if there was a problem with a provider, whether it be the guy cleaning your gutters or doing your taxes, you now have an advocate
That's
and
absolutely right. Such a good point, Steve. Such a
yeah.
good point.
Yeah. So, okay. Let's see. Looks like we got through most of the questions here. Oh,
That's a
Carolyn
great
shares.
resource. Yeah.
Yeah, no, that's the best thing about doing these discussions. A lot of times the people in the audience have just amazing resources. And
Thank you.
The
Yeah.
ARP has a tax aid program. Check that out, Beverly. Um, let's see. We've covered a lot of ground here, Steve. Now, out of curiosity, something that we didn't talk about is aging life practices come in all different shapes and sizes. And, from single proprietors that
Yes.
basically run their own caseload
Yeah.
to larger organizations. Out of curiosity, the practice that you're with right now, how many care managers are in that?
Right now, so I'm working in a nonprofit organization, and we have 4 people doing private care management. I have 2 people who are doing care management with those who were recently homeless, who are now housed
Wow.
uh, through Jewish Family Service. I have still 4 other case care managers doing other work around home care management, helping to ensure that when people have home care in place, that someone's overseeing the caregivers. So we have different programs, and
Huh.
every different organization has different variations on the theme. Uh, but I run a staff of 28 office staff and professional staff, and 450 active working caregivers. So we have a decent size organization in the LA area.
Wow. At the beginning, you were saying you were involved in a national venture capital backed
Yeah,
operation. So you've really been all over the place. In so
it's really been an interesting journey. I'm a social worker by training, and so that's just always is the core to what I do. And it is such a pleasure to be able to lead the Aging Life Care Association this year again. And really, it's all about raising people up and really
yeah.
making people better professionals.
Well, your breadth of experience makes you an ideal leader for the organization in the next chapter. I think that's wonderful. I knew this was going to happen because whenever I say I got through all the questions, another one comes in, and this says principal illness navigation, which is a term I'm not familiar with, but it says principal illness navigation such as cancer, diabetes, kidney disease and dialysis. Are you familiar with this? And can you talk about how Medicare is now paying for this? And can any of your members bill Medicare or insurance?
Our members can't because we are not directed by physicians, nor are we we're not providing a medical service, and so therefore it's not being reimbursed by Medicare. However, there are navigation programs that are often offered through medical systems that have figured out a way to get reimbursed by Medicare to provide this level. So I know that I have a family member who has diabetes who's getting care through Kaiser, and there is a case management navigation program that Kaiser covers that is paid for through the medical system. And we're seeing more and more of that. Uh, it is it's a relatively newer type of service, the PIN, and it's something that I'm looking forward to. I think that there will be ways for it to overlap with what we're doing as community-based, private aging life care professionals.
No, that's exciting. Kelly says, "Do I see Yoda in your background there?"
You do, and that Yoda guides me daily. That's funny.
Well, and we could think of care managers as the Yoda
Right.
guiding us through this. Yeah. Um, Now, someone said, did Steve say that he has 450 care managers in his
No,
organization?
caregivers,
Caregivers. Yeah.
working caregivers,
Yeah. So it's no, you
home care and care management integrated practice.
okay. So and I believe you've got, like you said, four care managers.
For private care managers, but total care managers in our company, about nine,
Okay, great,
just
great.
different programs.
Okay. And okay, and I'll make this the last one. Does the association offer any assistance during open enrollment to help elect Medicare options?
You know, there are services, I can only speak in California. In California, there are organizations that specialize in that. So when we have clients who have that concern, we direct and we connect them with organizations that are free of charge to provide that kind of consultation. And it's their area of expertise because every year there are little tweaks and little changes in the law. And we want to make sure that our clients, and we try to learn about everything, but we also want our clients to be best directed.
But this is a great example of where, and I've heard stories having done so many of these with people that have hired care managers, is when you're looking for advice on Medicare, you feel like you're all on your own. And so you're calling these people, you talk to them, but if you've at least know you've got an aging life care manager that, hey, I called this company, they said X, Y, and Z, I'm going to do this. It's just an educated ear that you can bounce some ideas on. And I this is just one example. It could
And
be
I see that Carolyn had also said, which is a great resource, the AAAs, the Area
yeah.
Agency on Agings, can also be a great source because many of them offer that as a consultation or counseling of older adults to help get them that information about Medicare options.
Yeah, and I'm dropping in the elder care locator info into chat there because that is another great national resource that covers every county in the country. So
Yeah.
just like aging life care. So um, this has been great, Steve. Anything that you think that we missed? I feel like we covered
Wow,
it all.
it was a whirlwind trip. Thank you. Oh my goodness, this was such a pleasure. Steve, you're great at what you do. It's clear you have a passion for the
Thanks.
industry and the community, and I just really appreciate being included. As I said before, this is something that is so important to me, and I really love the opportunity. So thank you.
Yeah, and then before we hang up, I am putting on the screen. This is our next discussion is going to be on March 5th there, and it'll be an Aging Life Care Roundtable. Somebody asked for your info, so I'm dropping your email in there, Steve,
Perfect.
for them to get in touch with you. And I am really psyched to be connected to the Aging Life Care Association and doing these monthly discussions. I think
You
it's
know,
just
that we
great.
are grateful to you. And so we so appreciate it, Steve. Thank you so much.
All right. All right. We'll see you all at the next one. Thanks.